Good afternoon, everyone. I'm Priscilla from HIMSS Asia Pacific, and thank you for being punctual and for joining us today for a webinar brought to you by Napier Healthcare Solutions and HIMSS Asia Pacific. For today's webinar, we are honored to have Mr. Anil Kumar, Vice President of Product Management at Napier Healthcare Solutions with us, and he'll be sharing with us on how we can make connected health a reality. A brief introduction of our speaker today. Anil is a seasoned technology executive and entrepreneur, having led product companies from startup phase to growth and acquisitions. He was the founder and CEO of several management solutions startup companies before they were acquired. Anil started his career at Siemens and Microsoft as senior engineer and holds a bachelor's degree in computer science and engineering, as well as a master's degree in management from Yale University. This is going to be an interactive session, so if you have any questions for Anil, please send it to us at the Q&A chat bar found on the top right corner, and we'll have Anil answer them as time permits after the session. So for now, over to you, Anil.
Thank you so much. Hello, everybody. Good morning, good afternoon, wherever you are. Welcome. I'm very excited to talk about this topic today because it's very close to my heart. I have personally seen the ideas and concepts around connected health evolving over time, over the past decade or so, in several countries across geographies, both in the developed world as well as the developing world. And I've seen some of the challenges, difficulties it has had in its implementation. And while seeing that and while personally experiencing that, I've also been fortunate enough to be a practitioner where we have built technology products and solutions to enable connected health. So on both these fronts, I've had a fairly close look at what's happening with connected health over the last decade or so. So today, we're going to talk about how to make this a reality for our patients, as well as for providers like yourselves, many of you on the call, who can embrace it to increase revenues and provide better care, superior care to your patients. So that's what we're going to talk about. Fairly excited to do so. So over the next 30 to 40 minutes or so, I've shared my agenda here. We're going to talk about the different aspects of connected health. Many times, connected health is, kind of looked at in a fairly, a certain way. We'll try to broaden that perspective about connected health. And we'll look at what are the potential opportunities that it unlocks for businesses, for healthcare providers, patients, and the stakeholders. And we'll also look at some of the technologies that are enabling connected health, both technologies that probably you've seen today, heard today in your day-to-day lives, as well as some things that are coming in the future that will accelerate the connected health ecosystem. And finally, the most important part of the discussion will be around business opportunities and how do we make business models viable with connected health, and how you as hospitals, administrators, aged care centers, healthcare providers, and payers can embrace connected health and make that a reality for your businesses. So that's what we're going to talk about. All right, so before I dive into connected health, I'll start with a very simple formula. Typically anything that is related to new ideas, new technologies, technology-enabled innovations, I think there are some three simple things that are required to make it work. The first is the readiness in terms of technology and process. When we talk about readiness, there are two aspects to it. One is the technology itself that you're embracing, whether that is mature enough. And secondly, once the technology has matured, has the organization, does it have the processes and the technologies in place to internalize it? I think both these aspects of of technology readiness is fairly important. So that's the first thing we're going to talk about. The second is the right use cases and user adoption. You might have the greatest technologies, you might have invested in some of them, but unless we figure out what are the use cases where this can be applied in healthcare, in your healthcare practice, and what is the user adoption, whether users are ready to adopt it, if that is not figured out, then I think it falls flat. And then the third area which I talked about in my introduction as well is what are the business models that make connected health work and scale the business. So these are the three things that we'll keep referring to, very simple things which are important to make connected health a reality. And I think at the end of this presentation, you'll get a better sense for, what is the technology maturity, what's your readiness, the right use cases, adoption, and the business models. Okay. All right. The first aspect is, defining connected health. Sometimes, many times connected health is only referred to as some of the wearables and the plethora of devices that are coming in, which we hear about in the news, in any of the journals. I think that is important. It is, provides the final connectivity, the last mile connectivity with the patient, where these devices can transmit data, over the phone or the cloud, and this can be examined and the data can be used for as part of the connected health ideas. But this is just one aspect of connected health. The second aspect of connected health is the connected services, the healthcare services. Many of them, if you look at the services today, you'll have to go to 5 different places or 10 different places to get the complete services that are required from a patient perspective. And if you can look at it more holistically, then this is a set of services which can work in association, in conjunction with each other, so that services can be provided at a common place, or services can all be connected from a patient perspective. So that's the second aspect of connected health. And the third is the systems. So you've got these services, but then the systems also have to connect with each other to provide seamless information and data transfer for the patient data perspective, or the systems itself to be connected so that it provides a coherent experience. So the systems could be data like EHR, it could be information about a patient, care plans, protocols, and so on. And finally, some of the more mature systems, we could call them or refer to them as an ecosystem or a healthcare ecosystem, where some of the national and regional governments would aggregate data, services, policies, protocols to build a connected health ecosystem. So now, first thing what we have done here is kind of defined what is the connected health for it to be successful. It's not just the devices. The devices is one part of the story. The second is the connected services, the connected systems, and eventually, in some of the mature environments, a connected health ecosystem. Okay. Now, once you start connecting these 3 things, you will start looking at what are the opportunities that you can, the integrated health delivery opportunities that it opens up. So connecting these devices, services, systems will transform the paradigm for healthcare, both for patients by empowering them, and later during the conversation, we will also see how this can be a game changer for your business as well. So one of the first things it does is, from a hospital-centric care or a clinic-centric care, it broadens the aspect of healthcare from care in one place to care anywhere, anytime, probably 24/7. So we're looking at care transitions from a hospital to a nursing home, aged care centers, rehab centers, and eventually moving to the patient's home. This drastically, as you can imagine, improves the convenience factor for patients. Healthcare reaching out to them as opposed to them reaching out to the place where healthcare can be provided. That's a fairly significant potential that this unlocks. And while we start looking at that, then we look at multidisciplinary teams. Obviously, when you look at the healthcare being delivered in all of these areas and all of these places, you're looking at multidisciplinary teams that are required to support and provide the healthcare to the patient. So coordinating care becomes important so that everybody has the right information, aware of the right protocols. Hence, a connected health system enabling data and process flows becomes important. So with this, you will be able to transform the care from siloed care that you provide within the 4 walls of your hospital or center or a clinic to more coordinated care where all the stakeholders are part of the care process and delivery. Probably the biggest potential from connected health will also be to transform the healthcare system itself from chasing a disease, being disease cure focused healthcare system, to actually disease prevention focused healthcare system. And this is an important transition. We're talking about sick care to truly health care, and that is possible with connected health today. And we'll talk about how this transforms the patient experience. It also transforms the business for a lot of the healthcare providers. See, today we diagnose these problems at fairly later stages, and we're scrambling to figure out how to solve the problem. I think having the right set of monitoring for patients with certain risk factors, where data can be collected, which leads to early diagnosis, alerts being formed or being alerted based on the data patterns and the monitoring, early diagnosis that is possible. And with this early diagnostics could be course corrections that can be done with more monitoring that can happen, which leads to delaying the onset of certain conditions and degenerative diseases. So this is fairly powerful in terms of understanding the care that is delivered today for chronic conditions and chronic diseases. So we've seen now that what is connected health, what is the potential that connected health can have in terms of the transformative effect of how care is delivered and how healthcare is practiced. Now let's actually look at this with a real world scenario. Let's look at actually a scenario which could be a lifecycle mapping of a patient. So in this case, I've got Steve Hansen, who knows that he has got multiple chronic conditions, and recently his general practitioner, Dr. Albert, recommended that he use a care management application, right? And through this application, he is able to measure blood pressure, blood sugar through his medical devices, connect this information to his health record, and this also provides him an easy way to connect to his general practitioner. So while he's doing that, one of the days he experiences some chest discomfort, and he's staying alone. So he automatically alerts the two people closest to him, his sister and his son who's staying abroad, and his doctor, his general practitioner. So within a few minutes, he is able to connect with the doctor and have a discussion over teleconsult. And based on what the doctor knows about Steve, based on his history, based on his records that he has with probably regular monitoring that he's been able to do, he suspects that there could be more complications, and he's able to refer him to a cardiologist, Dr. Williams. And through the referral system, he's able to transfer all of the data that he has about Steve Hansen, with his permission, of course, to the cardiologist. So the cardiologist doesn't have to start by asking, who are you, how old are you, what are the challenges you are having, and so on. He has all of that available to him on his mobile application or the EMR that he is able to access from an iPad or any tablet device. So when Dr. Williams looks at it, he says, there should be more tests done, and he advises that he goes to the hospital or his clinic to get some of these tests done. And while he says that, either he can, pay for, put those lab orders. In this case, Steve's son is involved in the whole process, and he quickly even pays for some of these tests. And the people who are to conduct these tests are ready for Steve when he reaches the hospital. So imagine this, before I get there, my tests are paid for, and I'm ready to actually undergo some of these tests that Dr. Williams is saying. So I go ahead and do these tests, and in this, the Lab Connect that is available would automatically put the test results all on a single electronic health record, which is now available to Dr. Williams. He goes through it. He says, this probably is more serious than what he thought, and he should probably recommend that he goes through an angiography or an angiogram. So that results come through, and Dr. Williams is able to see that he requires actually a surgery, an angioplasty in this case, and he's able to recommend that he goes to a hospital that he's connected to. All the information and data is transferred into the hospital. He's admitted to the hospital, and he gets the procedure done successfully. So while all of this is happening, I think though he's staying alone in this case, when I said that, his son is able to kind of monitor everything that is going on, because there is a patient portal, there is a update that he can get, that he can see in terms of his medical records and the progress that he's making. So the journey continues. So he gets discharged from the hospital, and he would probably sign into a long-term care facility because he wants to take some rest, get some continuous supervision. Instead of staying at home, he goes to this long-term care facility. And one of the things we'll see here is that the long-term care facility is associated with the hospital, so that the data and the information about Steve's condition and his rehab and his care is quickly available within the rehab facility. So Steve gets enrolled, and you can see Dr. Williams is able to send the discharge plan, the care instructions through the referral management in the nursing home solution that this long-term care facility is using. Right? So now we have seen that the data is transferred from from the clinic to the hospital, and from the hospital to the nursing home care. And once Steve's health records is retrieved, and even right from the pre-admission, the nurse staff is able to use a nursing app where they're able to monitor his vitals, record his vitals automatically, review some of the care instructions that have been given, take care of his medication management, the medicines that he needs to take care of. All of that is happening right from within the mobile EMR application. So while he's being cared for in the nursing home, you can see that his family can keep track of his status. The family portal is also available where bills can be settled online, and he just doesn't have to worry about anything except for getting better, and his family is also at peace. Once he gets discharged from the nursing home, he chooses to get some home care, where he can get some personal care and checkups done on a regular basis. And even right there, the home care knows of all of the care plans that he has to undergo, the medications that he has to take, his activity regimen. All of that gets transferred, so people can just verify whether how well he is focusing on his care. And like I think when we started out, we said he was doing a care management app. Now he continues to use the similar app, which includes also home monitoring, where he has post-discharge instructions and care instructions and care plans that come to him with reminders, and he's able to continue to track his vitals and ensure that he is doing well. So what we have seen in this whole journey is how he is connected, how he is able to prevent some of the conditions from getting worse, and how he is able to go throughout the entire life cycle from one clinic, from a clinic to a hospital to a nursing home to a home care, and get many of these information being transferred, and his care is probably getting the best care possible. So after we looked at this patient journey mapping, now let's look at some of the technologies that are making this possible. And these technologies that are empowering patients and their families. We'll look at what some of these technologies have today, and what are some of the new technologies that are coming in this area. The first thing that we'll look at is the mobility interface. What I heard is, on an average, a person looks at about their mobile phone, about 100 times a day. I was horrified when I heard that, and I actually turned off my WhatsApp notifications after that. And now I'm sure it's reduced for me, the number of, I don't know how much I was using, but I think it's definitely reduced for me. But the reason for me to share that is that begs the question about why not have a mature, systematic, mobility-driven interface for doctors, nurse providers, and other caregivers. I think that definitely needs to be the case, because if this is what the medium that most people are used to, then why have those clunky systems? If you go to any hospital, you will have a cart that pulls a laptop or a computer that gets wheeled around, for entering data. I think you saw in the example earlier, EMR access for doctors anytime, anywhere. In the example that we had a big impact. The interfaces that are possible today, the integrations are possible today, and that can simplify the way a doctor or a care provider would look at and monitor patients. And similarly, if we look at nursing apps, nursing applications, I know even in some of the developed world, people will start writing down, a nurse will go to a room and start writing down the vitals or what the medications that need to be given on a piece of paper or on their hand, and then come back and enter into the system. I think a lot of those can be solved with having mobility interfaces that reduces the risk for errors and issues, and can lead to much faster and better response. Studies have shown that having a good, mature mobility interface for both doctor and a nurse together can save up to about 2 hours a day in terms of their effort and issues using the system. That's about 2 hours a day, which can be used for a better purpose, to see more patients, do better consultations, evaluations, and provide much better patient-centric care. So the first area we want to look at transformation here is the mobility interfaces that can be integrated into your solutions care. We'll talk about some of the current systems and how to transform them, but those becomes clearly an area that could be transformative in making connected healthcare happen. The second area is the connected devices. I think there is a huge number of devices that we keep talking about. There are ones that we have seen, from basic Bluetooth-enabled monitors, glucometers, and so on, to fitness bands, and there are glasses, and there are tattoos, medical tattoos that can be embedded, which can provide some vital information about the patient, and so on. I think what is happening there is huge amount of data being tracked. I think there was a study which was done that a patient, if during their lifetime, creates about 1,000 terabytes of data with some of the monitoring devices that are either there today or in development today. That's a huge amount of data, humongous even for Google, and less than 1% of that probably is the clinical and the lab data. So there is an opportunity to take data from different sources. And two things are happening in these connected devices. I think one is some of them are getting embedded in smartphones and smartwatches, and a lot of these devices are becoming cheaper and better. For example, we are working with Samsung on a product called S-Patch, which is something that is being released. It is FDA approved, cleared by FDA. And that can continuously monitor heart rate and ECG, and can conduct ECGs on a continuous basis, almost to the same level of a hospital-grade system. So imagine the amount of opportunities that opens up in terms of home monitoring with a device like that. And the final area we're going to talk about is telehealth, in terms of new technologies that are making it possible. The idea of telehealth is old. It has been around for a very long time. People have had disillusionments as well with it. But I think things have improved. I'm going to show you some stats about some of the adoption rates as well. I think with improving, the two things why this has improved. One is, things like phones and the bandwidth have become better. More importantly, the clarity of use cases has emerged. Telehealth is useful for certain cases which I think people are ready to accept and adopt. For example, basic consults, which can be delivered at lower cost. Second is follow-ups that doesn't require a full thorough review of systems of the patient. And quick and immediate triage opportunities. In the example that we had there, it was very obvious the doctor could very quickly get back to Steve and also recommend that he go to a cardiologist and transfer that record to the cardiologist. Things like that makes telehealth viable, and also some scenarios around home monitoring and care management scenarios. So now let's look at some of the one aspect is new technologies. The second is these technologies have to work in conjunction with some of your existing systems. And obviously you will have to look at how do you take some of the closed systems. Many of you may be operating a very traditional solution which may not have interoperability or external interfaces. It's probably time to look at some of the systems that that you have and look at either modernizing the system or integrating these existing systems with new technologies. I think for getting the true benefit and the transformative effect of connected health, you will need a cloud-enabled IT infrastructure which supports certain standardized protocols like a HL7 or a FHIR interface. It is important that you look at modernizing the system with these protocols, integrate wherever possible with some of the healthcare cloud infrastructure that exists, either from a national perspective, regional perspective, and then start looking at interfaces for mobility that we talked about. These could be solutions that are built with existing systems that you have, or mobility interfaces that can connect to any existing HIS application through the HL7 or the FHIR interface. A lot of these applications are available. And then start looking at a holistic service model, which we will discuss later as well, in terms of business models that you can deliver with this. And it becomes important for you to look at how do you have, even when you start bringing in new modules, how do you bring it so that it doesn't become disjoint with your existing system, and you start looking at vendors who have a more holistic approach and a vision which will combine a lot of your solutions. I also have here a reference architecture. This is from WSO2, which is one of the standardized healthcare architecture for connected health. And what you will see here, this is probably an ideal architecture. You may not need every single bit of it, but when you start looking at opportunities for transforming your current systems, you look at who has a vision, who can kind of bring in this kind of an architecture within your organization. So as you will see here, there is a need for a serial bus, there is a need for a service bus for healthcare, which will connect the different services, workflows, and different cloud services, both within the organization as well as outside, which is available through the government systems or insurance companies and so on. So the idea here is to connect all of these solutions using protocols which can create a unified data model which can eventually be consumed by different applications within your organization. So let's look at, I think I talked about, if you remember, the three simple things that I talked about. One is the technology readiness, the other is the user adoption, and the use scenarios. So this is a picture from about a year ago, and I think this is data which kind of shows you that the use of telemedicine has increased significantly over the last 3 to 5 years. And today you can see that over 60% of them, that means more or less everybody, a large portion of them have been using phone as a medium to connect with their doctor and get advice or get a certain question responded to. And what you will see is that even with you people using a telehealth live video interface, about 22% of them today are using it overall, and that is up from about 5% 3 years ago, a significant jump from 3 years ago. The other thing that you'll notice there is the satisfaction rate, for example, is 83% with live video, which is much higher even from the phone interface. So that kind of tells you that this is moving in the direction where the adoption rates are reaching a point of inflection. And even in our own studies, for example, we did a study in Singapore with IMTA where we saw a 7.5% improvement in average glucose readings with the population that we were doing the study with, compared to about 3.1 without telehealth. So with telehealth was a 7.5% improvement in glucose, and without was about a 3% improvement with the care management program that we did. So that shows you that patients, there is an impact eventually with using some of the telehealth opportunities that we have, and has an impact directly on the results that you will see. And you'll also see companies like Apple, for example, bundling Care Kit as part of standard. Every phone that gets shipped today with iOS 11 has Care Kit, which is similar to Health Kit, I think, which kind of transformed everybody at least tracking their activity data on their phone. I think Care Kit does something similar, where it will push the possibilities of care management and reminders and monitoring right to the phone, and kind of makes it mass consumption for scale. Right, so we've kind of looked at technologies, maturity levels, adoption levels, and now let's shift gears towards looking at the business case and the business models. I think the first aspect that you want to look at is broadening the view from your current view of your business to looking at the ecosystem, or look at the patient journey, the patient mapping that we did. You will realize that in this case, Steve Hansen went through many of these boxes and probably a lot more, and this is just an indicative picture, right? And what this is trying to tell you is that, if you are focused on acute care, if you're focused on, typically you're looking at a hospital information system with adding an EMR to your organization, probably look at other aspects of the potential opportunities with care. Could be transitional care, could be home care, and so on. Similarly, if you are providing some of the aged care services for your patients, start looking at home care as an opportunity to be tapped into. And when you look at this, these businesses or these services can either be provided, one, as an integrated care, so it becomes a differentiator for you. So you're a hospital that also provides some of the other services around home care or transitional care. Second, it could be a new business model that you want to explore. This could be using existing staff, or a completely new business model that you want to look at. And the third way is to start looking at it as an ecosystem of partners. Not all of these are relevant, so I'm not saying that you have to start looking at all of these things at once, but you want to start looking at some of these aspects as part of the overall patient journey and how you can provide superior care to your patients. So when we look at these business models, right? So when we look at, for example, a telehealth service, and this could be an add-on service that could be offered to your to your clients, to your patients. Each of these add-on services can be looked at as an independent service, where you want to look at making it sustainable, where it adds revenues and profits to your business. Or it could also be looked at as a way to subsidize the add-on services as a differentiator for your overall service or product offering that you have. So I have here quite a few opportunities. When you look at telehealth, is one service, that one of the services that you could look at. Home care is another service that you could look at. You could look at it as working with a partner or having your own service and connecting the electronic health record and the care management applications from the hospital to the home care provider. So when we look at some of these opportunities, we are in a practical world working with several similar organizations like yours, on deploying some of these services. So for example, with a hospital in the Philippines, we have a care monitoring program that is offered to their patients. And what we have done there is we have a program that is designed which includes the monitoring devices, a monthly doctor review that is offered to the patients as a combined package, and so the patients can take their readings and their vitals at home, and all of this data is fetched back into the hospital EMR, and they have ways to connect back with the patients, both based on the alerts that are triggered or based on the monthly or the weekly review that is scheduled with the patients. Similarly, we have a hospital in Malaysia that is charging a fee for patients' portal access. I think you might think adding a patient portal or a patient application, of course, might cost some money and also cost effort to implement and operate it, but it has become a in their case, they're defraying their costs. They have a way to charge for a patient for portal access, where all their digitized records, the entire history of the patient's interface with the hospital is provided to them on their patient portal, and also provides priority for some of the services that they are booking. So the idea is, whether it is long-term care or whether it is referral management, we'll talk about referral management also in a little bit more detail next. Each of these opportunities can be looked at as add-on services, which has independent, profitability metric to it, or as a service that is a differentiator for you. And when you look at some of these things, you could also integrate this with your existing infrastructure, or provide a way for you to work with partners, preferred partners that can deliver some of these things with some integration done at the back end in terms of referral management, in terms of data transfer, and so on. The last area I talked about was the healthcare ecosystem. I'll very briefly talk about that before I kind of open to some more questions from your side. There are some examples of connected health ecosystems that are managed by the governments. Good examples are, for example, what the Singapore government has done with NEHR, where all of the health records of a patient is connected irrespective of which hospital that you go to. Similarly, there are examples where I can think of Netherlands, where they have integrated short-term care, hospital care, as well as home care. All of these three things are integrated into a common ecosystem where the patient data and the records and the payments and all of those are getting transferred from one to the other. So while some of these things require government vision and an execution at a fairly grand scale, you can also start looking at building these connected networks for some of the private hospitals as well as healthcare groups. And the technology for some of these things is possible today. So one of the areas you want to look at is expanding your network of GPs, or general practitioners that you work with. And there is an informal referral that anyway happens in some cases, and you probably have certain doctors that are working with the hospital, and then you have the extended network which probably doesn't work in the hospital but is associated with the hospital. There is an opportunity to kind of connect this into forming a network that can streamline the referrals, enable management of health records during the referral process, and also, more importantly, enable communication and collaboration between general practitioners, specialists, hospitals for patient care. So specialized technology and tools that are required to make this work and to make a connected network work is available today, and you can kind of build your own self-sustaining network, while some of the larger initiatives might require a lot of government support. So that kind of brings me to the summaries of what we discussed today. If you remember, I started out with three things. I started out with technology readiness. I talked about the use cases and user adoption, and we talked about business models. So you want to look at the connected health strategy. So like I described before, there is a fairly broader definition of connected health, which can be delivered either through additional services or through partner networks and so on. You want to look at what is your strategy that you want to adopt. Then you want to look at some of the technology inflection points. We talked about mobility. I think it's definitely low-hanging fruit that can be attained. We talked about some of the integration or the inflection point as far as telehealth is concerned. I think it is growing rapidly, and I think it is there to reach that stage where I think more or less everybody would start demanding that. We talked about transforming existing solutions to having a more modern look at it, while you look at interoperability, where you start looking at solutions that provide the kind of standardized protocols that are required to make this work. We looked at some of the opportunities around patient monitoring and chronic care management. And we looked at some of the use cases, and we looked at the Steve's journey, which is probably an idealistic scenario where he started out and being already monitored, trying to identify issues that before it happened, and going through the entire journey from going to a specialist, to a hospital, to getting some lab tests done, to getting discharged to a nursing home solution, to care at a nursing home, and finally at home care. So I think throughout this journey, you will see that there are multiple touch points with the patients that probably you're not directly involved with. You want to look at what are the care extensions that are possible, and to do that, what is the kind of business model that you want to look at. We talked about new business lines. We talked about add-on services that you can provide, which independently would be profitable or adding doesn't take up a lot of your bandwidth or cost. We looked at partnerships as a way to further some of the goals around connected health, and then we talked about probably building a connected ecosystem, either with the government vision or even without, where you can connect your larger pool and the larger ecosystem of doctors and other providers that you work with. So finally, I'll leave you with this thought. I think as I said, I've seen this closely over the last 10 years. I think in the next 5 years, the pace of acceleration, the pace of what we have seen in the last 10 years is just going to grow much faster. And the thought that I have there is, potentially you will have in the next 5 years, there'll be solutions and there'll be systems where you could do some tests at home, which will monitor several conditions, not probably one condition, like maybe just doing blood sugar tests at home. There'll be a lot more tests that are available today that will become more pervasive over the next 5 years. And these results get fed to a healthcare network where multiple people can look at it. The right specialists can provide interventions, and these are provided at hospitals, clinics, work, and also at home. And I think that is truly transformative in terms of how healthcare can be delivered, and connected health has a huge role to play. So that kind of comes to the end of my conversation monologue here. So definitely want to see more questions, both online here that you can ask from the chat window. You can also send us offline at a later date. I'm sharing the email address that you can send questions to. And we're also happy to engage with all of you who are exploring potential opportunities with connected health. Thank you very much.
Thanks, Anil, for the informative session. Anil, we had a few questions come in while you were presenting. So the first question, you spoke about telemedicine, IoT devices, as well as applications. What about sensors? Does Napier produce sensors, and do you provide a platform for real-time information of the patient?
Yes, we don't make or manufacture any sensors, but we do have a solution which we call as remote patient monitoring, which can integrate with variety of devices, including multiple sensors. There are sensors for fault detection that we are working with. A lot of different vendors that provide a fault detection sensor, especially in aged care setting. I think this becomes extremely important, as you can imagine, that if you can figure out a way that somebody needs help, then that is probably the best thing that the service that one can do. So I think we have several sensors that we have integrated with as part of our solution, and we're happy to engage and figure out the specific needs of the organization and the sensors that they are looking at.
Great, thanks, Anil. And the next question, the attendee mentions that technology is not the limitation here, and workflows are often very clunky, be it paper or IT workflows. How do you think we can improve these before we put more IT investments on top of them?
Sure. For somebody like that, I would look at, I don't want IT to be an investment. I think when somebody starts looking at, technology and IT as an investment, I think, or a huge investment, I think some of these things, we'll start questioning some of these things. So, for example, what we have done in many of the cases is we have offered solutions where there is a subscription model, there is a pay-per-use model. The example that I gave with the patient portal is that it has its own business case where they would recover the entire investment that they would make within a certain span of time, which is viable for the business. Even with some of the solutions like the patient monitoring that we talked about, it is possible to design it such a way that it is, there is a model where the patient pays for it and sees value with it. Now, obviously, a patient will only look at it and will adopt it once they start seeing significant value from it. I think there is models where these can be availed, these can be used in a way where patient pays for it, and the resulting value is a business case that works for both the vendor that is working with it, the consultants who are helping it design the solution, as well as the organization that needs to eventually deliver it to the patients.
Thanks, Anil. And the next question we have from our attendees. If a remote patient needs medical care and his or her network is down during that in that situation, is there some sort of alert mechanism, or how are we addressing these type of challenges?
You're right, to a certain extent that there is a need for the systems to be connected. I think we have in certain cases. So, for example, in one of the nursing homes that we have worked with, we have both the regular panic button within the application as well as a physical panic button, which is always connected in the organization as a backup as well. So I do understand that there will be certain scenarios where not having the network is could be a roadblock for some of the adoption for these systems. But we have designed solutions where we have certain backup, at least for the emergency care in certain scenarios. I hope I answered the question, but if there's a follow-up, I'm happy to discuss that again.
Thank you so much, Anil. And following on a similar question, you also mentioned that telemedicine is growing, but from an infrastructure point of view, do you think we would have challenge reaching out to patients or individuals at high altitude areas?
High altitude areas. Okay.
Do you think there would be network problems or challenges around there, or from an infrastructure point of view, have you had any experiences in those areas?
Sure. No, we do have, and I think we have deployed some of our telemedicine systems in some of the remotest parts of the world. I think obviously there is certain challenge with respect to when we say, for example, we talk about live video or telehealth using a video interface along with the data from some of the devices being beamed to the doctor, right? On the other side having a pulse oximeter and a ECG that is being transferred over. Obviously, some of the requirements for bandwidth do exist, but many of these systems today work with fairly low bandwidths. And for example, a video will automatically turn off if it is not able to relay the right amount of the right quality of video. which may not be required in some cases. As long as you can turn on a video for a certain period of time, that might be sufficient. So the ways that systems are designed is each one of the data that is being transmitted has a priority. So for example, it's more important that the values from the BP monitor or the pulse oximeter or the ECG is more important many times than seeing the patient live, and the voice of the patient and the voice of the attendant on the other side is far more important. So we have ways in which you can prioritize the different aspects. Then it is possible for us to manage it. That's how we have been managing it. I mean, the first example that comes to me is one of the implementations that we have in Malaysia, which is probably about 300 kilometers from KL, and I think it is in a fairly remote place where we do have some of these challenges with network, and but that has not slowed. I mean, they have definitely slowed down in terms of being able to go and implement everything that they wanted to do, the customer or in this case the aged care center wanted to do. But I think it is definitely reached a point where it is one of the primary ways in which they would cater to their needs of their residents, and that being a fairly remote area is one of the ways in which the doctors and the medical staff do get involved in providing patient care. So it is mainstream. It is, and I think the short answer to it is, there are examples. It is mainstream. It is possible to prioritize the different aspects of telehealth based on the challenges of connectivity and other issues you would have.
Great, thanks, Anil. And the final question from our attendee is also a trending topic in our space right now. You talked a lot about an interactive and integrated infrastructure. How do you think we can ensure the security of our patients' information through this infrastructure?
So I think I can go into the details of the technical aspects of how it is handled, but I think it is important that you first have these interfaces which are fairly standardized. Instead of building custom interfaces, many times you will try to bring two systems in. You've got a hospital and you want to bring a home care in, and you want to start building a custom interface. I think some of those probably have the highest challenges with respect to security. I think the more standardized interfaces that we start using, many of them have built-in security elements, and obviously you will have to go through a security audit. You will have to ensure that the systems that you are using, that you are transferring data to, is a trusted network and is a trusted provider or a partner that you want to work with. So the short answer to it is, security is definitely something that should be looked at. Is it a huge concern? Not yet, but something that we should definitely address as part of an implementation.
Thanks, Anil, and also thank you to all of our attendees for sending us your questions. And before we end off, just a few questions from me, Anil. Connected health is certainly an attractive proposition, and you have also charted out how well it could cover healthcare and transform it for the better. But all of the technology that we mentioned incur costs in licenses, devices, equipment, implementation, and training, etc. How much could all of these add up to, and how do you think a healthcare provider can defray the cost?
Sure. I think it's an excellent question. I think just tagging along to some of the points that I was making, I think you want to look at connected health as an enabler and a transformative force for your business and your organization. Obviously, when we look at all the aspects of it, you may not want to start with everything that we talked about today. That's why I think I had about a slide where we talked about 6 different areas that probably you want to look at, and each one of them can be looked at as an add-on service which has its own P&L or a profit loss as far as the service is concerned. These can also be done with partners. There are several organizations where we are consulting with, where we have built a partner network for them to build this and implement this service as opposed to doing all the investments themselves. So if there is, for example, a home care provider that is that has the infrastructure and has a capability, then maybe it makes sense to partner as opposed to provide your own. And while you partner, you have the right policies and the right integration so that it kind of becomes a seamless service for your patients. So the short answer to that is, one is, you start looking at each one of these as add-on services that will actually add revenue to you and has its own business case as opposed to thinking of it as an IT investment. Second, look at vendors, look at solutions which can provide you the flexibility to make this and work with you as a true partner, where as these solutions get adopted widely, then everybody makes money. The provider makes money, the vendor and the IT service provider makes money. So I think that's the right model to look at it. Somebody who's there to just sell licenses and walk away is probably the wrong vendor that you want to look at, is the short answer to it. And then I think we are getting to a point where I did give several examples where even small things like a patient portal has become a revenue positive solution for them, which kind of provides subscription-based fees where the patient is able to see all of these things, which adds value. And the other big aspect that we forgot about is loyalty. I think the fact that if you can connect more of the dots, if we saw so many dots that Steve Hansen went through, right? So if you can connect more and more of those dots as a healthcare provider, automatically provides the kind of loyalty and the kind of satisfaction and the net promoter score. Obviously, it is going to improve your net promoter score as far as a business is concerned.
Great. Thank you so much, Anil. And to our attendees, thank you for your questions, and thank you to Anil for the presentation and for answering our questions. Again, if you have other questions for Anil after this, I have shared my contact information in the chat bar. Feel free to reach out to me if you would like to be connected with Anil. And Anil and his team has also very kindly offered to share their presentation deck today. So if you'd like to have a copy, it will be up on HIMSS Asia Pacific member resource page, and you can also reach out to me for a copy. And I hope this session has been productive for all of you, and I look forward to speaking with you again for the next webinar series. Thank you again to Anil and Napier Healthcare, and to everyone for joining us. And have a great rest of the week. Thank you.